hear the word contraception and immediately assume it's only correlated to preventing pregnancy. But have you ever thought about the other benefits? There are so many uses for contraceptives that go beyond what is commonly known, and people don't even realize that because it's not talked about as frequently. Doctors should be able to prescribe contraception to any girls who may need them. It's a safe alternative that can help with many different medical conditions and should be kept available to girls under the age of 16 because physical and hormonal changes often begin far earlier. These girls should be given the chance to choose what's best for them as opposed to having the right taken away because they're too young. Today, I'd like to talk about the benefits of using contraception and some of the different medical conditions it can be used for beyond preventing pregnancy. I am by no means claiming to be an expert on this topic, but I have done research using the Center for Young Women's Health to learn about different medical conditions where contraception is used, and Guttmacher Institute to find some statistics about the use of birth control pills. First, let's talk about what contraception is. It comes in many different forms, whether it be a pill, condoms, injections, just to name a few, and it is designed to prevent pregnancy, but that's not the sole reason for its use. Most girls begin their menstrual cycle before the age of 16, and with that comes side effects, the most common one being cramps. Surely Advil or ibuprofen can help subside the pain, but that doesn't work for everyone. Birth control, on the other hand, could be a good alternative that does work for them, which is why doctors should be able to prescribe it to girls in need. I'm sure we all know girls who PMS or suffer from hormonal acne, so what if I told you that contraception could help ease these symptoms? These are just a couple of the more common side effects women deal with, but others might have polycystic ovary syndrome, which causes a hormone imbalance that can lead to irregular periods and excessive hair growth. Taking contraception could help ease these symptoms and regulate their periods. On the other hand, some might have endometriosis, which causes pelvic pain during the menstrual cycle. Taking birth control could help lessen their period and the pain they experience. These are a few of the positive outcomes that come from taking contraception. Now that I've told you what contraception is and different cases where it can be used, along with some of its benefits, I'm sure you're wondering, but what about the negative effects? What if it isn't safe for these girls' bodies? Or what if it causes future health problems? And while those are valid concerns, studies have shown that complications are very rare. In fact, women who take birth control are less prone to having anemia, which is a lack of red blood cells in their body, or even ovarian cancer. As long as the girls who are asking for birth control aren't at any risk or have health problems that could interfere with them taking it, there should be no problems, and the age ban should be lifted for that reason. Statistics show that 14% of women who take contraceptives rely on them for non-contraceptive reasons. That's equivalent to 1.5 million people, which is a pretty big number if you ask me. So if there are 1.5 million who need contraception for reasons beyond preventing pregnancy, then it should definitely be available to young girls who need them for the same reasons. In conclusion, now that I've given you an overview of the reasons contraception could be used that go beyond preventing pregnancy and explaining some of its benefits, don't you think it should be available to younger girls? It does them more harm than good, and doctors should get rid of the ban altogether for that reason. Contraception can help better their livelihood, and that's the biggest reason why girls should be able to take them at whatever age they believe is necessary. Thank you.